What would you say if I told you that I can help you get rid of your headaches and protect your teeth at the same time without taking medications to do so? Headaches are a problem that a lot of people like to try to figure out what the cause is on their own, and they have some pretty interesting ideas when they come into my office as to what may be behind how they feel. And what is often very surprising to them is when we start to explain to them headaches may not be caused by where your monitor is or how you're sleeping at night or how your stress in your life is going, but it could very well be related to habits that you've created for yourself over time. And those habits could range anything from clenching and grinding to the way you're sleeping at night. Probably one of the most amazing things to many patients is having them wear a splint at night and stop taking the medications that they're taking for their headaches. Often people don't need to take the medications, which are simply masking the symptoms of clenching and grinding their teeth. They feel better, they're sleeping better in the evening, and they wake up in the morning more refreshed because they're not tossing and turning all night. Medications can do a lot of things for you to cover up how you feel, but often they interfere with your sleep cycle as well by putting you into a different mode of sleep. So even if you're getting by without the discomfort, you're not getting a good night's sleep, often doing a lot of tossing and turning. We found that many of the patients that we've made splints for actually are sleeping better, their jaw feels less tense in the morning, and we're eliminating some of the destructive forces that they're creating, not only to their muscles, but also to their teeth. And some of the side effects, headaches, neck pain, finger pain, tingling, a lot of those things are going away. And I'm not talking about a few people, I'm talking about a couple thousand patients that I've helped over the last 10 years by making splints for them that are appropriate for their situation. Not one splint fits all. A patient come into my office and tell me in tears that she was tired of going to the doctor and trying to figure out what was causing her headache, neck, and jaw pain, as well as triggering migraines. When I did an exam on her, I realized that she was doing some clenching and grinding, and through some extensive testing, figured out that she was not necessarily grinding her teeth, but more clenching them. After making her a splint and her wearing the splint for less than 4 nights, she came back to the office to tell us that her headaches, jaw pain, and neck pain were completely gone. She's been wearing the splint for, well, since then, and has actually had me make her a second one that she puts in her travel bag, so that if she ever does go on a trip, she doesn't leave this thing at home, because she's found that when she doesn't wear it or doesn't take it with her, her headaches come back almost immediately. There's a lot of talk out there about what a tension headache is and what a migraine is. They can be confused for the same thing. Tension headaches can basically debilitate a patient just like a migraine can, and often I believe that they are misdiagnosed. One of the most misdiagnosed scenarios is a TMJ ache and an earache. I have patients come to my office and say, yeah, I just got over having an earache. And I say, do you swim? Have you swam in the lake? Are you in the water much? No. How many times do you get a headache during a year or an earache? Well, I get earaches about 2 or 3 times a year. And I'm pretty convinced that those earaches are not earaches, but actually TMJ pain, that basically if anybody does anything or if they wait a week, they'll go away on their own, but they will come back. What normally happens is they go to their doctor, they get medication or an antibiotic to treat that earache per se, and that earache does go away. But guess what? It would have gone away anyway. The medication did nothing. It just happened to be there when things got better. Probably one of the most important things to understand is what TMJ actually is. Temporomandibular joint pain or temporomandibular joint dysfunction is basically flaring up of the muscles of the joint and of the jaw, and that help open and close the jaw. You actually have a joint that is up near the ear, and if you open and close you can feel things moving there. It's one of the only joints in our body that has 2 movements, so we consider it a diarthroidal joint. It not only rotates, but it actually moves down and forward as we open and close our mouth. When that happens, a disc, a very small piece of cartilage, moves along with that mandible to help keep things staying smooth. When people develop a pop and a click in their jaw, it's usually because that disc is either getting worn, thin, or the bone is actually popping on and off of that disc as we open and close. That can be exaggerated and manifested by someone who's doing a lot of clenching and grinding, because as the muscles get fatigued, they don't act in unison anymore, and so we get some odd opening and closing, which can cause the bone to pop off that disc and give us that pop and click. Many times, once someone's wearing a splint or has figured out a way to relax those muscles, everything works in unison again, and we don't have any problem with popping and clicking. Pop and click in your jaw is not good. It is telling you, just like a pop or click in your knee or your hip, you'd be aware of that and wonder what's going on there. There's something that's not working smoothly, and it's not like we can rest our jaw. You can't say, I'm not going to speak or eat or swallow today. That's not an option. So we can rest an elbow or even a knee, but the joint, our TMJ joint, we need to protect it. If someone's having some pain in their ear, pain in their around their temporal, up in this area, their jaw hurts or pops and clicks when they open and close, that should be addressed. That's not something that's going to go away, or if it does, most likely it's going to come back. And the most important thing is to identify the source of that discomfort. Often it's clenching or grinding. We see a lot of patients for consults in our office regarding jaw pain, tooth pain, ear pain, things that they're tired of having to have dealt with prior to that they found no relief. And often, in my opinion, the people that are trying to help them are looking in the wrong spot. So if you think you're having problems, I highly encourage you to call our office and come in for a free consultation.